Hello everybody, I'd like to present our work on muscle stiffness in gout. It's a collaboration between sports science and health sciences and the Research Design Service. Gout is the most common inflammatory arthritis in men, and in both its acute and chronic forms tend to cause us ongoing foot pain, and our previous work has identified that there is significantly reduced lower limb muscle strength. We sought ultrasound imaging has been used previously in gout, and what you identify is in this top picture that the Achilles tendon is the stripy thing in the middle here, and it's easy to see deposits of gout within the tendon itself. Elastography is relatively new, and what it does is it sends pulses of ultrasound through the tissue to determine how stiff they are, and the deeper red-purple colours indicate stiffer tissue, and stiffer tissue is better at transmitting force through tendons and through muscles. We sought to recruit people from our podiatry clinic, both gout patients and age-matched controls. We looked at their demographic and clinical characteristics together with their activity levels, and all of them underwent ultrasound scans and elastography of both Achilles tendons by one operator. We found that there wasn't any difference in age or gender, ethnicity, or levels of activity. People with gout tend to have a higher body mass index, and they tend to also have more comorbidities, especially around cardiovascular disease and osteoarthritis. There weren't any differences in their tendon ultrastructure in terms of the thickness of tendon and those types of identifiers. They did have significantly lower levels of tendon stiffness in gout patients. So in the top picture here, you can see that this is a non-gout participant, and that the elastography scan is superimposed over their tendon in the background, and you can see that there's a nice homogeneous pattern, and all of the scan points are in this sort of deep reddy purple colour, which suggests their tissue is stiff and therefore quite good at transmitting muscular force. In the bottom picture, we've got a gout patient. It's much more heterogeneous in terms of its makeup, and there's a variety of different colours, and this highlights that these gout patients don't have the ability to transmit force through their tendons quite as successfully. So we found there's significantly reduced tissue stiffness in people with gout in their Achilles tendon. Their Achilles tendons are probably less effective at transmitting muscle force. And interestingly, our measures of tendon stiffness in gout were similar to people who have Achilles tendonitis but don't actually have gout. We also suspect that people with gout might be more susceptible to further pathology and injury in their Achilles tendon, particularly if they start to undertake sporting activity.